Thanks very much, Rebecca. It looks like we've already got a question in the Q&A, so that's good to see. So, as Rebecca said, our next speaker is Rumana Huque, who is professor in the Department of Economics, the University of Dhaka in Bangladesh. She specialises in health systems and health economics, with a special focus on healthcare financing, resource allocation, and budgeting. She's also executive director at ARC Foundation, Bangladesh, which is a research NGO working in health system strengthening, urban health, mental health, working with a number of development partners in universities in the UK and North America. She has wide experience of working with the Ministry of Health and Family Welfare in Bangladesh, local NGOs, and international donor agencies since 2000. She also leads the Bangladesh team of CoStar, which is an international large-scale project currently being led by Rebecca within the kind of context of C for AMR. So, Rumana, we're really grateful that you found the time to talk to us today, and over to you.
Thank you. Good day, everyone. I take the opportunity to thank Global Health Network for inviting me to join this webinar and share the experience from Bangladesh about how to engage with communities and policymakers for antimicrobial resistance discussion. I hope I am audible. So we know that there are growing awareness and concern about antimicrobial resistance at the global level. But from our experience, we saw that there are limited understanding and experience at the country level, like in Bangladesh, about community and policymakers' engagement, especially for AMR. There are a wide range of stakeholders, but they all are working with limited coordination, and the knowledge, priorities, and motivations of these wide range of stakeholders are really less understood. There are also limited understanding among these stakeholders about the One Health approach, and everyone is working in silos in many instances. So identifying the key issues and messages for developing AMR advocacy strategy, tools, and communication materials are really important. And we also need to consider that how we can sustain these AMR containment activities through the stakeholder engagement. At the first stage, definitely we need to identify the key stakeholders who are involved or working in AMR containment, and we need to understand and assess their knowledge, priorities, and motivations of working in AMR containment. And we need to identify the stakeholders, their availability of resources. And also it's important to identify the factors that could influence the sustainability of their effort. And we also need to identify this wide range of stakeholders and how to engage with them. So what modality works for which stakeholder. And we really need advocacy strategy, which should be evidence-based if we really want to achieve the goal of AMR containment in a low resource setting like Bangladesh. So the question of today's discussion is mainly that what approach or what approach is really useful and effective to address the behavior change with regard to antibiotic population, and also for the policymakers with these resource limited settings like Bangladesh. And simply sharing the information and increasing the knowledge may not be sufficient to make the behavioral change, and we need to understand the cultural and socioeconomic issues. So culture and social networks also very important, which really influence the people's behavior. And what works in one context may not work in other contexts. And we also realize that the top-down generic approach may not be effective. And intervention aiming to change people's behavior typically need to achieve very high coverage, and they are very resource intensive. So we need to understand that what coverage we are looking into, what resources are needed for all these type of. So I will share the experience of our study, that is community dialogue study, with the leadership of Dr. Rebecca King, with the partnership of University of Leeds and Malaria Consortium. ARC Foundation conducted the community dialogue study. And the aim of the study was to engage community through community dialogue to create awareness about appropriate use of antibiotics. We used local volunteers as facilitators who were trained on AMR, and they passed their knowledge on the wider community through this community dialogue approach, which then helped to reveal the local AMR issues in a participatory way. A few features of this community dialogue approach from our experience. So this community dialogue needs to be more than health education. There is a tendency among the health educators or facilitators or volunteers is just to run the one way communication. They give some information and they feel sometimes that, okay, the audience will understand, the community will grab those information. But in reality, it's really important to arrange a dialogue, to hear from the community also. So community dialogue that we try to implement in Bangladesh with the support of Melody Consortium emphasized on collective exploration of a health issue rather than some one-way direction of sharing information. And we also realize that the context and culture really matters. So community dialogue, which encourage identification of locally appropriate behaviors, are successful rather than applying any top-down approach. Because one size doesn't fit everybody. So we need to understand the local context and what works in which context.
Rumana,
for example, in Bangladesh,
sorry, can I just...
society, women have sometimes
Rumana, can I interrupt you for a minute?
Opportunity to
Sorry.
share their voice, and in a male-dominant society. Yes. Yes.
So,
Yes.
Rumana,
Yes,
you're breaking up. You're breaking up, so it's quite hard to hear you. So I wonder, maybe you could try turning your camera off.
Sure.
Apologies for that.
Sure. No, that's really helpful. So I don't know how far I was audible, but I will just say very briefly that one-way communication from the facilitator doesn't help. So it needs a dialogue and listen to the community, their problem, through the both-way interaction. And context and culture really matters. I was giving the example from Bangladesh, where it's a predominantly male-dominant society, where women sometimes have a limited voice in the decision-making and in the society. So if we really want an effective community dialogue, we have to hear the voice for everybody, and that needs to understand the local context and what works best in the local context. Though I said in the previous slide that often we try to scale up the intervention and we want to ensure the wide coverage, but in addition to the coverage, sometimes what is covered in the community dialogue and the content and the collective decision making is really important, which shapes the social norms, which affects the entire community and not only those who attended. So it's really important that what are discussed in the community are cascaded to the entire community through a wider coverage. Maybe the dialogue may not be attended by everybody, but there should be a system that this is cascaded, or the discussion is heard or shared by the community to entire population. Sometimes we have the understanding that this type of community engagement is very resource intensive, as I was saying earlier, but our experience shows that if we can really hire the volunteers and we can pick the right person who has the interest to work as a volunteer and to ensure working for a long time, and they have the commitment for the community mobilization and social work, then definitely with the limited resource, we can arrange the community dialogues building on the non-specialist volunteers. And this will enhance also the community ownership rather than resource intensive external interventions. In our experience, we found that some key lessons, which includes that local perceptions of community, it's also important. How we are defining community, whom we consider as community also matters. If we really want to engage everyone in the community in order to ensure that all sections of the community are participating, so we have to identify the community, and it is really important to understand how the concept of community is perceived locally, so that we can gather the community in those dialogues and engage them more effectively. It's also really important that we embed the entire process in the system, so that it increases the sustainability. So linking the community dialogues or any community engagement. So I was just saying that volunteering is also key, so which increases the community ownership, and engaging with the gatekeepers, we found it really important because there are local leaders and elites who work as the gatekeepers, and we have to ensure their buy-in so that we can identify the facilities, we can provide the training, and we can carry out the related activities effectively with their buy-in and support at the local level. In our experience, we found that AMR, it is a complex concept. So engaging with the community and creating their awareness is not very straightforward. So appropriate training of the facilitators is really important, who can then discuss with the community and create awareness. And facilitators should not only discuss as a health educator, as I was saying earlier, rather he or she should create a space, an enabling environment so that a dialogue happens and people do understand what are the concepts, and they can find out their own solutions within the community setting. And it is really important to expand to animal and environmental health, because we found that when we worked only on the health issues, we also felt that it is important to engage with the animal and environmental health issues also. I'll be very brief here. We also tried to engage with the policymakers, and when we've looked into the key stakeholders and the policymakers who can influence the policy, we found that government, and within government there are health, fisheries, agriculture, environment, a number of ministries whom we need to engage with. And there are development partners who also play a critical role in policy influence. There are professional bodies and there are private sectors, including the animal feed producers, pharmaceutical industries, and private hospitals, healthcare providers, and other laboratories. So they all play vital roles in influencing policy and practice. But we found that the AMR often described as an invisible disease, unlike other public health problems, and stakeholders in health sector and livestock sector have some knowledge about AMR, but there are varying level of awareness across the stakeholders, and there are inadequate knowledge about the magnitude and depth of the long-term effect of AMR. And within the public sector also, we found that environmental sector have limited understanding of AMR issues. And through our project and also other activities, we realized that it really needs continuous engagement with the policymakers to make them understand about AMR problem, and we need to support them for evidence-informed policy making, and we need to share the research findings in a way that the policymakers understand the key policy implications. And we need dialogue with the pharmaceutical industry, animal feed, and other wider stakeholders. We need to establish a partnership with the media also, who can provide greater audience, engaging with wider audience. And in addition to the health and animal health, we need to engage with Ministry of Environment, which is really critical. And we have to create a pathway of communication among all the stakeholders, which is really important. Thank you once again, and I'm really sorry for the technical problems at my end. Thank you.